And we welcome all colleagues who have joined. Thank you very much for taking time to join us on this important webinar. This is part of a 3-series webinar, and this one is focusing mainly on pre-service teacher education. And the title is Preparing Teachers to Foster Learners' Health, Well-being, and Life Skills, Practical Approaches to Pre-Service Training. We are eager to learn and share experiences in terms of how pre-service teacher training institutions are preparing our teachers to be able to address the growing issues that young people are grappling with when it comes to education for health and well-being. The issues around gender-based violence, HIV, emergency health outbreaks, relationships, growing up, you name it. So I hope that with the people, the speakers we have lined up today, will be able to ventilate some of those issues, and your contributions also will enhance and improve the program. I'm Lucas Halimani, Program Officer, Education for Health and Wellbeing with UNESCO IGBA. So I will call upon Quinton Hodon, who is the Director at UNESCO IGBA, to give us his opening remarks. Over to you, Quinton.
All right, thank you, Lucas. So indeed, I'm the Director of UNESCO IGBA. Thanks to all of you for joining. When I think about education for health and well-being, which is the topic of today, but also of the next 2 webinars in the series, I'm always reminded that there are 2 key dimensions in a way from a policy point of view. One dimension is the fact that educating for health and well-being is an end in itself, right? Today we are going to talk about life skills and other aspects. In a month, we will have the launch of the Healthy and Happy Learners work program, which is interagency. That will be a global webinar. And then the 3rd webinar that will be in December is going to be about inclusive education. And so we know that we need to educate children and youth so that they can benefit from as good health and well-being as possible, right? But I think that there is also a second dimension that sometimes we may forget, and it's a bit more instrumental. It is the fact that apart from the education aspect, in terms of health interventions, schools are actually a wonderful opportunity to reach not all children, but most children. And it's often extremely cost effective to have health interventions put in place, if you will, in partnership with the Ministry of Education and the schools. It's a low cost of delivery. It can have a huge impact. And so I think we have always to have those 2 dimensions, right? One, fundamentally, it's important to educate for health and well-being in the same way that we might educate for foundational skills, for ICT and so on. But 2, that schools are a wonderful point of entry for selected health interventions. And I hope that we can cover some of this in this webinar series with the 3 webinars, as I mentioned. The last thing I want to say is that if you have great innovations that you are working on, we always want to hear from you, right? And you can send us an email at IGBA. And maybe we can put that email, Camelia, the generic email in the chat. We want to hear from you because we can learn from you, and then we can share ideas, including with the African Union. I'm very happy that Ms. Sofia Shivala is there. She's the head for education, and she's going to talk, I guess, about some of the African Union strategies that exist for education and health well-being, and then also mental health for teachers. And we are very happy that the African Union is taking that at heart. So thank you, Luca, and back to you.
Thank you very much, Quintin, for those opening remarks. Very key 2 important messages that you have shared with us. Schools are important entry points for reaching huge numbers of our learners to educate them on education for health and well-being, not just entry points, but cost-effective entry points for that matter. And we need to educate for health and well-being as well. So thank you very much for those opening remarks. Now I want to introduce our keynote speaker, who is from the African Union, Mrs. Sophia Ndemutila Ashipala. She is the head of Education Division at the African Union Commission's Education, Science, Technology, and Innovation Department. In this strategic leadership role, she spearheads continental education initiatives and policy development for all the 55 African Union member states. She is a champion of transformative educational strategies that align with the African Union's Agenda 2063. Most recently, just last week, she co-moderated the successful launch of the African Union Decade of Accelerated Action for the Transformation of Education and Skills Development in Africa 2025 to 2034 at the landmark Pacted Conference. Ms. Ashipala has extensive expertise in education policy and continental governance, and she has been instrumental in advancing key African Union education frameworks, including the Continental Education Strategy for Africa. I'm talking about the new one now, 2026 to 2035, and the Continental Education on Education for Health and Well-being of Young People in Africa, which is the center of the discussion today. So, without much ado, we thank Ms. Ashipala for making time to be with us in a busy schedule. There's a lot that is happening at the AU right now on education, but she took time to ensure that she's with us and is able to share with us her perspectives on education for health and well-being. Welcome, Madam Ashipala. Over to you.
Thank you very much, Lucas, and really for that introduction. I am really humbled. Warm greetings to all the esteemed colleagues on the call, all the colleagues from the UNESCO family, member states, all the development partners, and all the friends of education. Thank you so much, really, for joining the webinar this afternoon and also able to share and participate and contribute to the webinar and to the discussion that is at hand. Yes, as Lucas has said, at the African Union, there are a number of initiatives that are taking place, and also, as we have indicated last week, a number of strategies were launched, and we are happy and we are excited for this collaboration that we have with UNESCO IGBA and also all the other partners that are supporting us. However, I want to acknowledge your presence here today, which is really demonstrating the commitment to transforming education for health and for the well-being of African young people. As we convene today at this pivotal moment in African education journey, we need to work collectively toward the aspiration of Agenda 2063, the African Union blueprint, the one that we speak about all the time. Also building on the achievement of the Continental Education Strategy for Africa, the one we are just concluding, and also for the preparation of the implementation of the new CESAR, the one that Lucas has alluded to, the 10-year strategy. And we recognize that our continent's greatest asset, which are our young people, they face complex challenges that really demand bold and innovative solutions rooted in evidence-based practice and continental solidarity. So if we are to take a moment to reflect on the context of Africa, we know that our continent is one of the youngest continents with the youngest population, yeah, with over 60% under the age of 35. So this demographic dividend really presents an extraordinary opportunity for us, but also profound responsibilities also, not only an opportunity, but there is something that we need to do. Our young people face health and social challenges that directly impact their learning and life prospects. Early and unintended pregnancies, these are some of the challenges that they are facing: HIV and AIDS, gender-based violence, substance abuse, mental health issues, and nutritional deficiencies. These are not just statistics, ladies and gentlemen. They represent really dreams that has been deferred, potentially unrealized. When a young girl, for example, drop out of school because of early pregnancy, when a learner struggle with untreated mental health challenges, when violence in and around schools disrupt safety, we see the deep, the undeniable link between health and education. So there is something that we need to do. So within these challenges, there are also opportunities. Education remains our most powerful tool for transformation. We know that when we equipped our educators, our teachers, with the knowledge and with the skills and the attitude that is necessary to foster learners' health and well-being, we create a ripple effect that go far beyond the classroom, yeah? To our communities, to our nations, and also to our entire continent. This is why I will be speaking briefly on why pre-service teacher education is central to our mission. As the African Union, we have the African Union Continental Strategy on Education for Health and Well-being for Young People. We launched it in 2023, at the end of 2023, and it is really positioning teachers as a linchpin of our transformation agenda. Why do we believe or think that teachers are at the center of this transformation? Because pre-service education is one of the most strategic intervention points. It is here that we can build the foundational competencies teachers will carry through their careers. When we integrate education for health and well-being into teacher preparation, we ensure every new teacher who enters the classroom is equipped to understand child and adolescent development, also to create safe and inclusive learning environments, and to respect and uphold every child's dignity and potential. That's why we believe that pre-service is really important. Currently, as we speak, too many teachers really enter classrooms unprepared to address the health and the well-being dimension of learning. They may know their subject content, of course, but they may lack the tools to discuss sensitive topics, yeah, to recognize distress or foster inclusivity. So pre-service education allow us to close some of those gaps, not through scattered in-service intervention, but through structured systemic preparation. And importantly, it allows us also to ground this preparation in African values, African cultures, African realities, and develop approaches that reflect who we are while upholding universal principles of human rights, gender equality, as well as child protection. Therefore, that pre-service is really very, very crucial. So the strategy that I am referring to is built on 4 pillars, which every teacher preparation program should be able to reflect. The first one is on promoting health lifestyles. The second one is on disease prevention. The third one is on safe, inclusive, and non-violent learning environment. On promoting health lifestyles, teachers really need to understand how nutrition, physical activity, these are some of the things that are part of the curriculum also, and mental health affect learning, not to become health professionals themselves, of course, but to recognize when learners need support so that they are able to refer them correctly and also at the right time. The second one on disease prevention, from the practicing of hygiene to knowledge about communicable and non-communicable diseases, teachers must promote health conscious behavior and safe environments. On safe, inclusive and non-violent learning environment, teacher must also be prepared to prevent and to respond to bullying, to violence and discrimination, to be the champions of inclusion and advocates for the marginalized. They should not be bullies themselves. And the fourth one, they should also have this skill-based reproductive health education. This is often the most sensitive area. Yes, we know that most of the teachers, they shy away from this specific topic, but it is really, really crucial. It's the most crucial one. Teacher needs to handle these topics with cultural sensitivity because of the different backgrounds of the children, scientific accuracy, and respect for diverse perspective, while also ensuring young people receive comprehensive, age-appropriate information that will also build their knowledge, that will also help them to make the right decision. So across all these pillars, pre-service teacher education must nurture 3 core competencies domain. They should nurture knowledge, skills, as well as attitudes. So on knowledge, the pre-service should really make teacher understand child development, health promotion, pedagogy, and the context. On the skill, creating the safe and learning space, they should be able to communicate effectively and using participatory methods. And on attitude, they should embrace inclusivity, continuous learning, and steadfast respect for every learner, right to health and education. So now, my dear colleagues, we know what we need to be done, okay? As I alluded into the 4 pillars that compromise in that framework or strategy. We have the framework is here. The evidence is also clear. What remains now is collective action, to our teachers, teacher education institution. As I said, we really need to audit our curriculums. You need to audit your curriculums against Education for Health and Wellbeing framework. Identify which one are the gaps that are there, integrate the competencies, but also add some essential building blocks of teacher professionalism. Explore blended learning, community partnership, and real-world practical experiences. And to our ministers of education, the alignment of policies and standards, it's really important. The inclusion of education for health competencies in teacher preparation requirements, as well as accreditation, and the creation of environments where teachers are really, really supported, And to our partners and all the friends of education, the support that you are providing should align with the continental priorities. Invest in capacity building that is sustainable, that is relevant, and it is led by African institutions. While our teachers themselves, the educators, we know that you are the ones that are shaping the next generation. So you need to model the competencies that you teach. Create safe, inclusive, and engaging learning environments. And we encourage that you continue learning, continue innovating, and also continue inspiring the young generation that you are nurturing. So to move from the vision to action, we must take specific steps. My dear colleagues, let us develop continental standards through our regional economic communities, standards that ensure quality and mobility while respecting local context. It is really important to respect the local context. Let us also invest in faculty development, creating centers of excellence for the education and health training and research. We need to leverage also on technology to expand access to higher quality resource and connect educators across borders. We should foster innovation by supporting research and produce African solution for African classroom. So the roadmap is really here before us. The Continental Strategy on Education for Health and Well-being, it's here. That is a roadmap. It is a guiding tool. So the commitment, therefore, is in this virtual room where we are, this webinar. And what remains is now is our will to act. We need to act and also to act boldly. Every teacher we prepare today will have to touch hundreds, even thousands of young people, young lives out there. When we equip these teachers with the education and health well-being competencies, we multiply our impact. Yeah, we create classrooms where every child feels safe, feel valued and supported to reach their full potential. We know that the teacher is indeed the most important factor in any educational system. The work that they do, they shape minds, they inspire dreams, and they build the foundation for a better future. So we need to equip them with the knowledge that they need to be able to transfer that knowledge collectively and accordingly. So this is a moment now to ensure every teacher in Africa is prepared, not just to teach subjects, but to nurture whole human beings. The healthy, the confident, capable young Africans will drive our continent transformation. Let us therefore leave this webinar not only with the new knowledge, but with really a renewed commitment when we return to our institutions, to our ministries, and to our communities with concrete plans for action. The future of our continent, it is within the hands of the teachers, yeah? Because they are the ones that are in the classroom. Let us also ensure those hands are well prepared, well supported, and well equipped to guide our young people toward a healthier, more prosperous, and an equitable Africa. Thank you very much, and back to you, Lucas.
Thank you so much, Madam Ashpala, for the inspiring and thought-provoking speech. I was almost spellbound and I could not stop you even when we were extending the time because the subject was interesting and the issues that we were exploring align very well with the discussion today. You handled the issues around what are the issues, the opportunities that we have is that as a continent we have a young population. So it's a huge opportunity, but it comes with responsibilities for us to prepare those young people for a better life. And that means the teacher and education are central to us building those young people. I will not summarize the good ways that you have spoken to us. I think we're all listening and we've taken your word and you were inspired to carry forward the discussion. Thank you so much for that keynote speech. The next on on the program is to request Dr. Patricia Machawira, who serves as UNESCO's regional advisor on education for health and well-being in Eastern and Southern Africa, where she leads the implementation of Our Rights, Our Lives, Our Future, the popular O3 program across 33 countries in sub-Saharan Africa. Dr. Patricia Machawira is a highly regarded education specialist with a PhD, and she brings extensive expertise in mobilizing resources and overseeing large-scale development programs focused on comprehensive sexuality education, HIV and AIDS, gender-based violence, and related themes. Dr. Machawira has played a pivotal role in advancing the East and Southern Africa ministerial commitment on comprehensive sexuality education, working with governments to strengthen policy frameworks and curriculum implementation. And of course, scholarly contributions include key publications on the ESA ministerial commitment, implementation, multi-sectoral collaboration between health and education sectors, and breaking down silos to improve adolescent health outcomes. So I have the pleasure of inviting Dr. Machawira to give us more context and more details, program interventions around this subject area of education for health and well-being. Over to you, Dr. Machawira.
Yes, thank you so much, Lucas, and thank you to Quentin and Sophia, the speakers who came before me, who've done a really great job of setting the scene around, the importance of education for health and well-being for young people on the African continent. Can I ask for the next slide, please? Yes, so my presentation today will focus on the work that UNESCO has been leading around the program, Our Rights, Our Lives, Our Future, which really focuses on promoting education for health and well-being for adolescents and young people in sub-Saharan Africa. So as we heard, you can move to the next slide. As we heard from Quentin, UNESCO strongly believes that healthy learners learn better, and that better educated learners have the knowledge and the skills to be healthy. So for us, investing in school health systems is a smart way for countries to improve the health and education prospects of today's learners who are tomorrow's leaders. So given the fairly high enrollment rates that we have in many countries in the region, schools provide that unique setting for preventive interventions, and the school years are an important period for young people to establish healthy behaviors that will continue with them to a lifetime of health. So this is the rationale that underpins the O3 program, which has grown to become the largest health education program across sub-Saharan Africa. Next slide, please. So this slide just shows us the program coverage for the O3 program. As you can see, across 35 countries, most of our countries, all those of us who are in the room, most of our countries are covered by the O3 program. And it has a target to reach about 30 million learners and, quite a large number of teachers, both in pre-service and in service. Next slide, please. So Sophia spoke to the AU strategy on education for health and well-being. I think UNESCO is proud to have partnered with the AU in the development of this, continental strategy. So the O3 program that I'm referring to really touches on the 4 pillars of the strategy, but with particular emphasis around pillar 3, which deals with safe, inclusive, and non-violent learning environments, and pillar 4, which deals with skills-based reproductive health education or comprehensive sexuality education, as we refer to it in some countries. So during this presentation, I'll use the terms interchangeably, life skills-based health education and comprehensive sexuality education. As you know that in the different countries, we use different terminologies. I think what is important is to ensure that all the content that we are seeing there is included in our curricula, despite the terminology that we use in the different countries. Next slide, please. So the work of the O3 program is guided by the UNESCO's global strategy on education for health and well-being, which focuses on 3 key outcomes. The first one being around supporting member states to develop resilient school health systems that promote physical and mental health and well-being for adolescents and young people. The second pillar is around good quality, gender transformative CSE or life skills-based health education that includes HIV, life skills, family and rights. And the third pillar being on safe, inclusive school environments free from all forms of violence, bullying, stigma, and discrimination. So as you can see, this is also aligned to the AU strategy that Sophia presented. Next slide. So why do young people need life skills-based health education or comprehensive sexuality education? We know that every child will one day have life-changing decisions to make about their well-being, about their relationships, about families, or life goals in general. But we also know that many of our young people grow up without this basic knowledge and also without the skills to make these important life decisions. At the same time, our children receive a huge amount of confusing and conflicting messages from the media, from the internet, from their peers, and voices from their community. And all these include messages about relationships, about love, about sex, and what it means to be a man or a woman. And sometimes this deluge of information can be confusing for our young people. So what we're saying is if young people learn in the classroom from a trusted source who is teachers, children and young people are able to understand and make sense of information that they may encounter elsewhere if they are receiving this information from teachers. Next slide. So, Iqbal asked us to speak to what is the status of education for health and well-being across sub-Saharan Africa. So as UNESCO, we are in the process of concluding a study where we looked at, to answer that question around what is the status of EHW across sub-Saharan Africa, we decided to step into the shoes of young people and understand how young people perceive the sexuality education or the life skills education that they receive. So we looked at young people in low and middle income countries, but for this study, I'm going to zoom in on the survey findings from sub-Saharan Africa because that is the region that is of interest to us. So the background to the study was that outcomes of sexuality education are increasingly being documented, but there's been little focus on first-hand accounts from adolescents and young people themselves on how they receive the sexuality education that they receive at classroom level. And this is important to inform policy, to inform programming, but also teaching practices around sexuality education, ensuring that the sexuality education that we provide to young people is relevant and appropriate. So the young people were asked, what are the needs? What are your experiences and preferences in relation to school-based sexuality education? In particular, the questions that were asked were around what topics do young people believe should be covered in sexuality education, and to what extent have these been covered in their curricula? How satisfied are adolescents and young people with the content of the sexuality education that they are receiving? How satisfied are they with the delivery methods of the sexuality education that they receive? How important is sexuality education compared to other sources of education or information on SRHR that young people may receive? And in what ways could sexuality education be improved according to adolescents and young people? And as young people are the beneficiaries, it's important for us to listen to the beneficiaries and understand how they perceive the CSE that is provided in school settings. Next slide, please. So I'll just take you to a snapshot of the findings. Yes. So sorry, just before, in terms of the methodology, just briefly, we had a global online survey across a number of countries globally, but for Southern Africa, we had 2,706 respondents. So 29% of the respondents came from Sub-Saharan Africa and from 33 countries in Sub-Saharan Africa in particular. And then we selected 5 countries where there were qualitative case studies. In those countries, we had focus group discussions, in-depth interviews with a variety of groups of young people, key informant interviews, and the participants generally were aged between 10 to 24, and we spoke to approximately 420 participants in total. So just to say that this study was commissioned to the Royal Tropical Institute in the Netherlands, but commissioned by UNESCO. Next slide. Just to take you quickly through the findings of the study. Camelia, please, next slide. Yes. So what came out from the can we go back? Sorry. What came out from the, so I think my slides are moving a bit slower. Yeah, so what came out from the Sub-Saharan Africa countries is, number one, school is the preferred source for young people to receive sexuality education, followed by community level activities, the family, and then healthcare centers. So schools were perceived by young people as reliable, and in particular, schools were selected as a preferred source by respondents who indicated being internally displaced or refugees, by respondents who were living with a disability, by respondents living in extreme poverty or informal settlements. So for these, schools was particularly selected as a preferred source. And this is so despite high numbers of young people reporting that they don't feel very safe at school. So for some, especially for the younger adolescents, school is the only place where they were able to obtain that information. And it was especially relevant when taught in depth and through practical exercises. I think this feedback is important because we are here today talking about teachers and how teachers can deliver this content in a way that is relevant for learners. Next slide, please. So in terms of content, what do young people what do young people see as being taught and what is missing? So many of the adolescents and young people often recalled that they learned about sexual and reproductive health and the human body. As you can see that on the graph, those are ranked quite high. Fewer young people reported learning about violence and staying safe, understanding gender, relationships, and pleasure. So learning more about the human body, sexual and reproductive health, puberty, HIV and mental health and emotions were highlighted as learning needs. So these are the topics that young people want to learn more about. Next slide. And what came out clearly is that the teaching methods matter. So young people reported that the lecture style of teaching was most common, and yet what learners preferred are creative, interactive, and stimulating methodologies. 54% of respondents indicated that they were satisfied with teaching methods, and those who were taught through participatory methods more often felt that they were satisfied with the delivery methods. Next slide. So educators shape learners' experience. I think that came out clearly. And the characteristics of educators that were valued most by learners, it's where teachers were perceived to be competent, open, non-judgmental attitudes of teachers, where teachers had skills to create safe and trustworthy environments, relatability, and enthusiasm on the part of teachers. Learners also cited some barriers, which included teachers' discomfort. I think that has come out clearly that teachers may be uncomfortable teaching particularly some topics that are sensitive. In some cases, teachers adopted fear-based and gendered messaging. or in other cases, deprioritized sexuality education and preferred to use the lessons for other, perceived more important subjects like maths and physics. Next slide. So in terms of safety at school, the learners were asked if their classrooms feel safe. Half of the learners from Sub-Saharan Africa reported that they do not feel safe to ask questions in class about sexuality education related topics. There's fear of judgment, humiliation, shame, and punishment. Girls reported feeling less safe in mixed classrooms, whereas boys feel underserved in sex-segregated classrooms. There were concerns around confidentiality, with learners worrying that teachers may tell parents if they open up during classroom discussions. And then experiences of bullying and school-related violence were reported to affect the wider school and learning environment. Next slide. So just to summarize, so what I've just tried is to give you key highlights from the upcoming study. So just to summarize the key messages that we are learning from adolescents and young people from this study is that schools are a preferred and trusted place for sexuality education, but the gaps limit real-life usefulness of sexuality education. Learners want more in-depth, relevant, and broader coverage of topics. Again, this is important as we engage in our discussions around teaching and how teachers can teach better and more effectively comprehensive sexuality education. Participatory methods were reported to lead to more satisfying and safer learning experiences. Trusted, well-trained, and empathetic educators are key to positive experiences. Safe learning environments are also reported to be critical by young people. So what are the implications for pre-service teacher education? What are the implications for the conversation that we are having today? I think, we will speak to, we've seen the common challenges in pre-service teacher training that are impacting content delivery. And these include lack of strategies for delivering the content, especially taking into account local realities, lack of knowledge, confidence, capacity, teaching materials, and teaching methodologies amongst both pre- and in-service teachers, lack of support, supervision, and mentorship for teachers. In some cases, when we train teachers, we give them a 3-day training and that's it. They're off and they have to go and deliver without any further support, supervision, or mentorship. So sometimes personal fears, values, and discomfort with certain content areas lead teachers to avoid, teaching some content and resort to selective teaching of content. So I think the implications are that we really need to engage with teacher educators to teach them how to utilize participatory methodologies to help students or their pre-service teachers to internalize the necessary knowledge and go beyond just imparting knowledge to imparting skills and also changing attitudes. So the way our pre-service teachers learn about the methodology behind the delivery of life skills-based education is then mirrored in how they then take this to the classroom when they teach learners. So for any in-service teacher training, it is important that we cover all content areas of the CSE curriculum in our countries. And we know that there are always challenges with curricular space when we are talking about teacher training. Next slide. So Lucas, I will leave the group with some reflections, even as we go into the country presentations, to think about, what is coming out of the study and what are the implications as we take this work forward at country level. So if we look at the topics that young people in Sub-Saharan Africa most recall learning about, and the ones that they said which are less commonly addressed, how does this compare to what is emphasized in your own curricula or classroom practice in your countries? Are there any topics that our teachers are finding particularly challenging or easier to teach? And then we spoke a lot about participatory methodologies, but maybe we can reflect on, in our different contexts, how much room do we have to move beyond lecture style teaching towards more participatory or creative approaches? What helps or hinders us in doing so? And then what impact do we think teachers' attitudes and approach to sexuality education has on how safe, heard, and informed our students feel? So we can reflect on that and even, have some of those conversations during the discussions, because I think it's one thing to talk about this is what is recommended, but it's another to really reflect on how practical this is in our different realities. We speak of classrooms that have 100 learners plus. How practical is it to talk about participatory teaching methodologies in such overcrowded classrooms? So let's have a conversation and maybe come up with some innovative ways that other countries have gone around some of the challenges that we've reflected on. So Lucas, over to you. We can go to the last slide. If people want more information on the O3 program, they can feel free to scan the barcode that is there so you can learn more about the O3 program. But over to you, Lucas, and thank you for the opportunity.
Great. Thank you so much, Dr. Patricia Machawira, for the articulation and the reflections that you have left us with and the key messages coming from the study that you have shared with us. I see a common thread through what all the presentations so far have tackled: the importance of the school system as an entry point to reach to the young people, the importance of the teacher in the education system, but the needs, of course, to attend to ensure that the teachers are well prepared, because the young people, when we consult them, they have their needs. They say, yes, we are receiving some education on education for health and well-being, but there are some topics which are of great interest to us, but we are not getting that information, and so we are not able to effectively build our skills, knowledge, and attitudes to help us grow better in a safe and thriving environment, and in a way that also supports the delivery of health education outcomes. Thank you so much for that presentation. I hope all of the listeners who are with us are challenged to take forward the discussion. When we go forward to the question and answer, we can share more experiences in terms of how we can respond to some of those reflections and the challenges that you have thrown to us. Now, we want to proceed with our discussion, now looking at a case studies, and we feel that we can learn from each other as countries. And one of the case studies that we have lined up for you today comes from Zambia. And we have a colleague, Mr. Oscar Chikumba, who is a senior lecturer at Chipata College of Education. Mr. Oscar Chikumba is a dedicated educator and advocate for youth development with over 20 years of experience in the education system. He holds a Master's of Science in Chemistry, a Bachelor of Science with Education, a Diploma in Secondary Teacher Science, and a Primary School Teacher's Certificate, demonstrating his comprehensive expertise across all educational levels. His teaching career began in 2004 as a primary school teacher, and he's progressed to secondary education in 2008, where he taught biology, chemistry, physics, and integrated science. And in 2016, he advanced to the college level instruction. Beyond his academic responsibilities, Mr. Chikumba is deeply committed to youth protection and empowerment, actively championing causes including gender-based violence prevention, human rights promotion, and child protection. He leads implementation of life skills and health education programs with particular focus on sexual and reproductive health, firmly believing that healthy bodies and minds are fundamental to educational success. We welcome Mr. Chikumba. Can you take the floor? You have 15 minutes for your presentation.
Mr. Chikumba, if you are in the room, can you raise your hand so I can enable the microphone for you? Lucas, I'm afraid that maybe Mr. Chinkumba has some connection issues. Should we move on to the next speaker and come back to him?
That's all right. Thank you, Camelia. As we sort out to check the situation with Mr. Chikumba, also have the pleasure of introducing Mr. Svangani Dube, who is a lecturer, Faculty of Health Sciences in the National University of Management in Namibia. Mr. Svangani Dube serves as a lecturer within the Faculty of Health Sciences, where he teaches a comprehensive range of health-related modules, including marketing of health and wellness management, and strategic management of health and wellness. He actively supervises research for both bachelor and honors degree students, guiding impactful studies that address world health challenges across Southern Africa. He is one of the pioneers of the O3 and O3 Plus program at the university, and has been instrumental in advancing student health, well-being, and empowerment initiatives. He currently serves on the O3 Plus Executive Committee for the university and contributes at the national level as a member of Namibia's National Health School Namibia National Health School Task Force, working to strengthen the integration of health and education. Mr. Swangan, the floor is yours.
Moderator, can you hear me?
Yes, we can hear you. We can hear you, Mr. Swangan.
I was thinking that maybe I'll come after my colleague from Zambia, because I'm struggling to upload my slides. I'm not sure if it is my device or the network. It's not even allowing me to send you my slides. I'm
Is
not
it
sure.
possible for you to share? You can share directly your screen.
I'm trying I emailed Mr. Lucas already, but seems like he can't open. And I've been trying to get into my laptop. I'm using two devices actually. This one is the tablet, and the real material is on the laptop. So
okay.
let me yes. So maybe my colleague from
Mr.
Zambia will go first, and then I'll follow while I try to troubleshoot. Thank you.
Please go ahead. Please grant me the access to the Google Drive that you shared for this, okay. And then I'll be able to.
Where is the notification? I did not get a notification asking me to grant you access. Because
check your email again. You should have received that.
Yeah, I'm on my email.
Who is presenting a case study from Zimbabwe. So let me introduce Dr. Herbert Mradzikwa, who is a senior lecturer at Bondov Teachers College in Zimbabwe. He specializes in health and life skills education and serves as the college's focal person for sexual and reproductive health issues. He holds a diploma in education, Bachelor of Science in Counseling, diploma in HIV and AIDS counseling and prevention, a master's degree in educational psychology from the Great Zimbabwe University, and recently completed his doctoral degree in educational psychology from Durban University of Technology in 2023. Dr. Mradzikwa's research focuses on the impact of health and life skills education on students' behavior, with particular expertise in sexual and reproductive health, counseling, and education. He is also interested in addressing gender-based violence in the context of higher education. As the vice chairperson of tertiary institutions counselors in Zimbabwe and an active college counselor, he has made significant contributions to curriculum development and the integration of health education in pre-service teacher training across Zimbabwe's education system. Over to you, Dr. Mradzikwa. You have 15 minutes for your presentation.
Thank you very much, Mr. Lucas. How are you, everyone? Right. My focus is mainly on the issues affecting college students. In fact, my work is to actually look at how we are capacitating pre-service teachers in order to handle issues to do with health, sexual reproductive health, issues to do with the HIV and AIDS, issues to do with gender-based violence, and so on. I will actually focus on how, as colleges in Zimbabwe, we are managing to make sure that all these students that are coming from teachers' colleges in Zimbabwe have been capacitated to handle health issues in schools. I will actually look at right. So in fact, let me say in Zimbabwe, due to a number of issues affecting our country in terms of the youth, we have tried to look at different strategies that we can engage in order to capacitate our students so that they are able to deliver lessons to do with health in schools. Maybe it is also important for us to understand that it is now mandatory in in Zimbabwe to teach health and life skills, which is also education for health and well-being. Here in Zimbabwe, we call it health and life skills, but it is the same as education for health and well-being. We have a number of policies that are supporting the teaching of health and life skills. For example, we have the HIV and AIDS policy. Recently, we also have the sexual harassment policy. All these policies are actually assisting us as teachers' colleges to ensure that the teaching of education for health and well-being is done effectively in our colleges. All right. What is very important about how Zimbabwe is offering health and life skills or education for health and well-being is that we now have modules that are compulsory, which means all teachers' colleges are mandated to teach education for health and well-being in their colleges, so that every student who comes from teachers' colleges in Zimbabwe has all the necessary skills to handle health issues, especially during their teaching practice and during their teaching after they have qualified as teachers in Zimbabwe. Right. It is very important for us to understand that health and life skills in Zimbabwe is managed to create a very safe environment for the students that are being trained, and there are a number of strategies that are being used by the teachers' colleges to try and make it very effective. For example, when students come for their first year, they go through some training, which we call life skills training for new students. It is a workshop that is run in all colleges for all first-year students to try and equip them with the skills to manage their life at college, because we assume that when the students come for their training, that change of environment requires them to go through some kind of training so that they are also equipped with the skills or coping mechanisms that they will use in order to manage the challenges that they face at college, as well as also being able to in turn be effective teachers who can also assist their learners during training, during their teaching practice and after training. We normally invite professional people to come and provide the knowledge during the workshops. We also work closely with UNESCO. I think we have held quite a number of workshops with UNESCO dealing with issues to do with gender-based violence, dealing with issues to do with SRH, sexual and reproductive health, and so on. All these workshops are trying to create teachers who have the knowledge on how they can manage the day-to-day lives at college. Right. In Zimbabwe, we have also noted that we have been very good in terms of making our students manage personal health. We have also been very good in terms of managing challenges that affect students through counseling services that are offered, because we have well-trained counselors residing at colleges to offer psychosocial support for these students. We also sometimes hold community health awareness programs where we talk about health issues, ensuring that all our learners, all our students, pre-service teachers are equipped with the necessary skills to manage the challenges that they face as pre-service teachers. At the same time, we also train our pre-service teachers a number of life skills, which we feel are very critical for their survival or for their work as students. Skills like decision-making skills, communication skills, emotional skills, and so on. Right. It is also very important for us to note that we also have a highly qualified people who are there to offer or to teach the modules on SRH or the modules on education for health and well-being. I think I've talked about, I once talked about that one, where we have different stakeholders who are working with colleges. One of them is UNESCO. I think we need to acknowledge the efforts that UNESCO has been playing in teachers' colleges, in capacitating lecturers. We also have other stakeholders like SAWAT. We have also NAC, National AIDS Council, and many more government organizations that are actually assisting
Dr. Mrachka, you have 3 minutes to go. Please wind up.
Thank you. Right. Oh, let me now quickly move to look at right. To look at this one. Yeah, of course, I think I have talked about the other programs that we hold, like the outreach programs that we hold. We also have clubs at the college, the peer educators clubs, that these are students that are trained to also offer services to their fellow students. Maybe let me quickly look at the challenges that we feel, or the gaps that are still there. We, as a country, I think we still have some challenges in terms of limited financial support, in terms of running certain programs. We feel that if we can also get that, it may assist in improving the quality of service that is being offered. We also have another issue on inadequate health facilities in certain institutions where certain services may not be accessed by the students because of lack of these health facilities. And lastly, a shortage of teaching materials may be related to ICT equipment. But all in all, I can say generally we are doing quite well in terms of behavior change on our students, and in terms of capacitation of our students in order to fight or to be able to effectively teach health and life skills or education for health and well-being. Our recommendations: the continuous training for lecturers and peer educators, improvements of funding and resource allocation, and probably increasing availability of health facilities for the students so that they are able to access certain services that they need. Thank you very much.
Thank you very much, Dr. Mrachka, for sharing the case studies from Zimbabwe. One key important issue that you have highlighted, that for Zimbabwe, health and life skills education is a standalone subject, which means that it is delivered as a separate, dedicated, and examinable course or subject. We know the advantages of a standalone subject. It ensures comprehensive depth of coverage and there's clear accountability measures, and with that dedicated focus, it is specialized teachers who are able to provide, teacher educators, sorry, who are able to provide more in-depth knowledge and build the skills of the student teachers. You also highlighted the dual role that student teachers play. They are also young people in their own right who are navigating a lot of the challenges that we want them to address at the school level when they become teachers. So you are working with them to actually ensure that they are able to address their own development needs and challenges. So thank you very much for highlighting those issues. I'm sure the question and answer session will take up some of the issues that participants may have. So without wasting much of our time, we want to catch up. Let me call upon Oswald Chikumba from Zambia to share this case study with us. Over to you, Mr. Chikumba. Can you hear me, Mr. Chikumba?
I think he dropped out. Luca,
Okay.
can we go to, yeah, please.
Have we resolved the issue of Sivangan's presentation?
Did you manage to get my presentation? I have granted you access.
Okay, let me check it out. Just a moment. Yeah, I see that I've received some. Yeah, I'm trying to open now the slides and then I can share with my colleague.
Lucas, feel free to just share your screen as you have the presentation.
Yeah, I'm loading the document. It's coming. It's a bit slow, but it's coming.
Mr. Chinkumba, can you hear us? I see you are connected online. Sorry, colleagues, please bear with us as we have the technical issues. Chikumba? Mr. Chikumba?
How many are we getting there? This Botswana and Swiss relation.
Mr. Chikumba, I see you are sharing your screen right now. Please go ahead. Mr. Chikumba, are you here? Can you hear us?
And is one of the largest and growing private university. Next slide, please. Next slide. My slides are not moving. I'm not sure whether it's my side. Right. So
Are you moving the slide?
No, yeah, go back. You are moving too fast. You are moving too fast. Go back again. Right, next slide. Right, so the our approach towards engendering EHW, you have moved too fast. You have moved a little bit too fast. So there is a slide on leadership. It's the third slide, I think. Yeah, it's the slide on leadership. Part of our role in entrenching the training of pre-service, especially from the O3+ perspective, is that I wanted you to see the slide because it's very important. The second one, the one that says leadership. Mr. Lucas, I want the one on leadership. So while this slide is coming, I wanted to say that part of the ways through the strategy through which we are rolling out the pre-service training is that, yes, is that first of all, we look at strategic leadership and intent, right? And we believe that for any program or project to be successful, there should be the involvement of senior management. The people that you see there, we have the former Pro Vice Chancellor in the early years of introducing O3 Plus, CSE training. You see the Pro Vice Chancellor there, and then also we have our strategic partners from UNESCO and also the Ministry of Education. The lady that you see in the picture, she's the Pro Vice Chancellor for Administration and Management. She plays a very strategic role in ensuring that the CSE project is a success within the university. And you can see from the background that CSE has actually found its home at the International University of Management. Next slide, please. So the next slide talks about the core team. These are the drivers. Yes, the core team. These are the drivers of the CSE program, which involves the pre-service training. So the ladies that you see in front, the lady in the middle is a lecturer. The one on your left is on your right is a university counselor, as well as the one on your right is on your left is a university counselor. But we also have representation in all our campus, the coastal campus, Ongwediva, Nkurenkuru, and lately Enana. Enana is our new addition. You are moving too fast. So this is the core team. So there is a core team within the university that drives the CSE program for pre-service teachers, right? And these are the guys who plan the activities. We do have a strategic plan that we drive for the entire year. Next slide. So after we have done our planning, now we are coming down to the operations, the implementation. We do advertise our comprehensive sexuality education training program on the university's media platforms, social media platforms, your Facebook, your LinkedIn, as well as your Instagram, because young people, that's where young people are. And we try to broaden this training as much as possible. And I've shared with you the other picture there. It shows our training in 2019. When we launched it, it featured on the UN website as well. And usually students, they fill in the form, we send a link, they fill in the form, they have to apply, right, for them to go into this program. Next slide. So when we eventually recruit, like the recent training, we had 60 students who applied. We actually launched the application platform, and then we had over 300 applicants, but we had a cutoff for 60 students. So 60 students made it to the program for in-person, for a face-to-face. So here is what happened. This is the program. You can see from the structure of the program, we do have people from within IUM, and also we do have experts, the Ministry of Education, from UNESCO, from UNFPA, and their insights, their presentations always add value to this program. Next slide. Next slide, please. So because of technology, this is, we had to hold this workshop on a hybrid basis, right? So there were students who did not make it for a face-to-face in Windhoek. So may you please go back a little bit because I want to talk to these campuses. I want to talk to that slide. The previous slides. Yeah, so on your left, that is the coastal campus. They are in the session there, and the middle one is is Kurenkuru. No, that one is Enana, right? The middle one is Enana, and also you can see in the background there, it was a live feed from Dorado campus in Windhoek. Next slide. Next slide, please. Right, so this is the Kurenkuru campus. You can see students are following the proceedings, and you can see some students are actually noting down some points as the presentations are taking place. Continue. Is it my device or is it my technology? Because slides are not, okay, cool. So another intervention that we do in campus is that we have got peer educators. So peer educators are basically our foot soldiers. These are the people whom we train to make sure that we sustain the CSE workshops and also to sell the CSE workshop and to make sure that we have enough personnel which can actually drive this information on EHW within the university. So this is a recent training. Sorry, I was lost a bit. Okay, so we brought students from all over the campuses, from all our campuses, because when we train peer educators, we bring them from all over the campuses, and then we train them in Windhoek. Here, we give them the skills. Then another issue which has also helped us in driving the EHW agenda within the university is that we have got other enablers. For example, we do have the cultural festival, and our peer educators normally have stalls where they sell the idea of UNESCO, the CSE, the O3+, and the Baza app, right? And also this year, IUM was honored by UNFPA. We hosted the World Contraception Day, and that was in Windhoek and also in Enana campus. Enana campus is our new ed. Next slide. So these are still on the enablers part. We do have students who participate in the Condomize. They do it on campus. They do it in collaboration with other campuses also at the University of Namibia, the Vocational Training College, and also the Namibia University of Science and Technology. On my right, they were doing a Condomize campaign at the Namibia University of Science and Technology. So this way students can get practical skills, how to implement what they are learning from the Comprehensive Sexuality Education Certificate Program. Next. Next slide.
Time is running out, Mr. Dube. Can you wind up?
Okay, cool. So we do have a handover ceremony. Once students have completed their certificates, we organize a handover ceremony, and we also give them speeches and to encourage them to implement everything that they've learned during the workshop. Next slide, please. Next slide. The slides. Okay, this is the handover ceremony. Just some pictures about the handover ceremony. Next, yes. So we also take our students to the Peer Educators Conference. So every year, students have to go to a Peer Educators Conference where they learn the skills, listen from others. And that way, we are also building capacity. We are helping them gain knowledge and skills as well. Next slide. And the Peer Educators Conference, basically, and also this is capacity building for the team. It's not enough just to empower the students. You also need to empower the team. Here, some colleagues were involved recently at a planning workshop for institutionalizing all 3+, and also some other workshops. Next slide. Next slide, please. So lastly, let's talk about opportunity. For every problem, there is also opportunities. So what are the problems? Limited finance, competing schedules, student turnover. Students are there to come and go, right? The lead time between graduating and securing a job could be a problem. The receiving schools, if they are not well prepared to allow students to implement what they've learned, becomes a challenge. The issues of monitoring and evaluation, that's the process, the outcome and impact. However, we see other opportunities despite the dwindling on funding. We can also perhaps try to tap into CRS, corporate social responsibility funding, develop an alumni network for post-graduation. We need to find a way, how do we keep these students in the loop so that what they learned and keep on updating. I think someone spoke about continuous learning. How do we help them when they are outside the school system? Strengthen the school strategic system from strategic management system. The issues of EHW should be part and parcel of the school strategic plan. That way it can receive attention from our experience. Overall structural issues in the education sector. Things have changed. Besides teachers, who else do we need in the school system? Right? Develop robust tools for monitoring and evaluation, and also encouraging student-driven research so that we can always get to understand what is happening and what knowledge can we get so that we can continuously improve our system. I think this is my second last slide for what I had prepared for you. Thank you very much for listening. And yeah, technology played my way. I did not really, I had to rush through my presentation. Thank you very much. Questions and comments are welcome.
Thank you very much, Mr. Dube, for the presentation. You provided us with another case study from Namibia with another dimension in terms of co-curricular approach, where EHW comprehensive sexuality education is delivered through clubs, peer education, and experiential activities outside the formal curriculum. You also invite experts and professionals to support in the delivery of that content. And this provides practical and experiential learning opportunities for the students. And of course, you've highlighted some of the challenges there. I think co-curricular approaches, as you have said, at one point there were applications of up to 300 students who were interested, but the program could only take 60, which means that a number of students are left out through co-curricular approaches. So thank you very much for that, and we apologize for the technology issues. Let's check if Mr. Chikumba is ready now for the presentation, the last one on case studies. Over to you, Mr. Chikumba. Are you ready? Can you hear me, Mr. Chikumba? Looks like we are having a connectivity problems for Mr. Chikumba. I will ask my colleague Mark to take us through the question and answer session.
Hello, are you able to hear me now?
Yeah, it's better now.
Okay. And my
my
slides are showing on the screen.
That's correct.
Yes. So my name is Chikumba Oswald. In Zambia, based at Chipata College of Education in Eastern Province. My presentation will talk about comprehensive sexuality education, which is now called life skills and health education in the Zambian setup. And this change of the name was actually due to the protests by the community from the name sexuality education. So they thought the name was giving a very bad picture. So when I use EOSHI or CSE, they mean the same. Actually, EOSHI now in Zambia, it is a curriculum-based type of education which focuses on knowledge, skills, values, and attitudes that help the young people make informed decisions to maintain and improve their physical, mental, emotional, and social health. So the main goal is actually to improve both the health and educational outcomes for young people. Next slide. The key aspects of life skills and health education are embedded in the health education part, which covers hygiene, nutrition, disease prevention, reproductive health, and physical fitness. Further, it promotes healthy lifestyles and responsible behavior. Secondly, life skills education also develops communication, decision-making, problem-solving, and self-awareness for the young people. Then it also helps learners manage stress, resist peer pressure, and build positive relationship. As we may know, that peer pressure plays a very negative influence in the young people in most cases. Then it also looks at the mental health and emotional well-being. So under this one, it helps build resiliency, self-esteem, and empathy, enhances emotional intelligence and mental health awareness. Then under social well-being, it fosters respect, teamwork, and peaceful coexistence. It addresses issues such as bullying, gender-based violence, and discrimination, so that the communities or the young people can live in harmony amongst themselves and again amidst other people around them. Next slide. The value of EOSHI or life skills and health education is that it promotes healthy lifestyles and prevents diseases. That is, when it is implemented as intended, then these are the values. It also improves academic performance because the concentration of the young people will be more on academic issues than the other devices or activities that they can indulge in. It also develops responsible citizens, reduces risk behavior among the youth that can lead them into unhealthy results. Then it also supports holistic development, mental, physical, and emotional well-being. Next. There are topics that are covered under EOSHI. The topics are the topics looking at personal hygiene and sanitation, nutrition and balanced diet, HIV/AIDS and other communicable diseases, reproductive health, substance abuse prevention, mental health and stress management, then physical exercise and safety education. Next. Now, looking at how ELSHI is being implemented in the Zambian setup, the modality that has been chosen is the integration method. The integration method is having career subjects. So all the topics that I mentioned, for example, in the previous slide, are aligned to the subjects that already have similar content on those topics. For example, science education, it looks at human body systems, nutrition, diseases, and hygiene, whereas social studies or civic education looks at human rights, gender, relationships, and community health. And religious education looks at values, emotional well-being, and empathy. Whereas physical education looks at fitness, recreation, and mental wellness. So this was thought so that people do not look at ELSHI to have created an extra job, but instead it should already be embedded in those activities or subject areas that are already present in the curriculum. Practical and experiential learning, which also includes physical activities, healthy clubs, and community outreach, such as teaching practice. It engages students in teaching, health awareness campaigns, and peer counseling or mentorship activities. So this is another included aspect which was intended so that there is no one left out. Those that are left out in a classroom setup, they should also have such an experience outside. The teacher educator training, the lecturers are trained in ELSHI via workshops and the continuous professional development, which is CPD, to prepare them so that they are capable of attending to the learners in their regular teaching. Then it also focuses on the child mental health, handling sensitive topics, sexuality, abuse, and gender equality. However, let me mention to say that in ELSHI is also supported by policy and curriculum. So ELSHI is supported by the national policies and teacher education frameworks. Those documents are there and are already in support of the implementation of ELSHI. Then ELSHI is implemented in a multi-sectoral approach where the Ministry of Health, Ministry of Education, and non-governmental organizations work together to support the implementation of ELSHI through the training and even outreach programs. Next. Yeah, barriers. It was noted or discovered that the barriers that were there in the implementation or institutionalization of ELSHI were: one, inadequate ELSHI in pre-service training, limited in-service professional development, low teacher confidence in addressing sensitive topics, then heavy workloads, and there was weak coordination between ministries of education, health, youth, and social welfare to work together. So because of this is the reason why it was thought that implementing ELSHI as an integrated component is the way to go. Then in the pre-service, they are also trained. The pre-service are also trained this time around in all those courses I mentioned, which are science education, physical education, social studies, which also has civic education and RE. So teacher preparation was actually addressed in that manner. Next slide. So in the Zambian scenario, as I mentioned earlier on, we use what is known as the integration in the career subjects. So the examples of the career subjects are those outlined: biology, civic education, RE, teachers are prepared using what is termed as the college hub model. By college hub model, I mean selected teacher education colleges, like Chipata College of Education is one of them, and we have 6 more to make 7 in total. They invite pre-service teachers. I mean, they train pre-service teachers while they are on the desk. This is actually meant so that they are already prepared to handle EOSHE as they get deployed in the mainstream of education. Similarly, the in-service teachers are also invited to the college. And in this way, in the implementation, as I mentioned, there is a multi-sectoral approach where the Ministry of Education, in this case the college, works together with the Ministry of Health and the civil society organization. I give an example for Chipata. The civil society organization which is involved to support is Regional Psychosocial Support Initiative, REPS. Then this is also embedded in the curriculum, as I mentioned earlier on. So even currently, as Zambia is undergoing a curriculum review, even the framework for life skills and health education at college level is also being reviewed. Then there are also national adolescent health strategies that are supporting this. Re-entry policy, which supports the implementation of EOSHE, which was made in 1997 and revised in 2016. Then there's also a school healthy and nutritional policy. Then, to just make sure that EOSHE is taken as a serious component, it is a curriculum-based, but again, it is also part of the assessment. By this, I mean it is also found in examinations so that we take it as a serious component and people don't miss it. Next slide. Next slide. Thank you. Now, the details of the College Hub model. We have the stakeholders that are engaged at all levels of education, and this has been like this so that we make sure to say that all authorities buy in the implementation of life skills and health education. So to just mention a few of stakeholders that are involved, we have the Provincial Education Office that is involved, then the District Education Office, and of course the school where the teachers, in this case the in-service teachers, are drawn from. These stakeholders I've mentioned are particularly engaged in identifying the teachers who are supposed to attend the training workshop at the colleges. Then, when these in-service teachers come to the college now, after the proper identification process, when they come to the college, they undergo a 5 days training to equip them with the necessary skills, necessary knowledge, and competencies that are required for them to handle life skills and health education. Knowing that head teachers in these schools where teachers are coming from are also essential in the implementation, the head teachers are also invited to attend a 2 days training workshop, which is particularly meant or focusing on the supervision, how they can supervise, how they can monitor their teachers, how the time they're implementing. So during this training now at college, the master trainers from the college and staffs from civil society organization and Ministry of Health work together to impart the knowledge, skills, and competencies in the learners. However, it is also good to note that the civil society organization does not just end with the support at the college. They also move in the communities where those teachers are coming from so that they support the community activities and, of course, the school activities. They also have caregivers within the communities who are also engaged in meeting the traditional leaders to seek their support in the implementation of life skills and health education. The college also does not just end with the training of these teachers. They also follow the teachers in schools to monitor the implementation at classroom level. So they sample schools and visit those schools to just check on how this is going on. Then the pre-service teachers are taught during the normal lessons, and they are also empowered about the skills, the competencies, the knowledge during the activities called continuous professional development, which have a particular day, and it is also in the college routine. On a Wednesday, like for Chipata College, in the afternoon, there is continuous professional development for students. And one of the activities that are done is the same, imparting knowledge and skills about ELSHI. Next.
Mr. Chikuba, can we wrap up in 2 minutes, please? As we're almost
Thank
at
you.
the hour. Yeah.
Thank you so much. So there are lessons that have been learned using this model, the integration model I've mentioned, as we do in Zambia. The lessons that have been learned are that the national policy and strategy anchoring, these policies provide legitimacy, funding, and accountability. Then cross-sector collaboration, by working together with other ministries like Ministry of Health, Ministry of Education, and the non-governmental organizations, it has proven to say that this teamwork produces positive results. Apart from that, we have also data and monitoring system where these people are followed to just check on how the implementation is going on. Next. Next slide. Then the school-based mechanism also has been seen to be working very well. The clubs that are created for ELSHI, the peer learning, mentorship, and safe spaces. Then we have inclusive and contextualized content, which is age up.
We seem to have lost Mr. Chikumba.
Yeah, I cannot hear him anymore. Mr. Chikumba, are you still with us? Well, this is the last slide from Mr. Chikumba.
Appropriate handling of sensitive topics. They focus on early adolescent. In the adolescents, as they are young, develops citizens.
I think we can move on to the Q&A. I know that we're almost at the hour, but I've seen many interesting questions in the chat, so I'll hand it over to my colleague Maki to facilitate the Q&A session.
Thank you so much. Thank you so much to all the presenters for the very insightful presentations. I believe that we have very little time left, unfortunately. So please allow me to just pose one question, I think, which summarizes our discussion very well. So we have a question from Osman Jawo. So the question is, why is it important to integrate health and well-being and life skills into pre-service teacher training program? Sorry, I think I'm hearing an echo. Sorry, could everyone mute yourself? Thank you very much. Okay, so the question is, why is it important to integrate health and well-being and life skill education into pre-service teacher training? And I would like to ask one of the speakers from the teacher training institutions to respond. May I call upon Mr. Sivangani, or if or Mr. Chikumba, if you're back, or Mr. Herbert? So why do you think integration of the life skill education or sexuality education is important in your context? And then how do you think it's contributing to the effective delivery of the subject on the ground? May I call upon Mr. Sivangani?
Okay, thank you very much for the question. I think the integration of issues of health, life skills, sex and sexuality plays a very important role, especially in the education sector. Why? Because there are so many issues that are happening lately in our communities. And the teacher who is empowered serves as the sounding board of sharing information which is scientific, age appropriate, and also these teachers can also act as a link between the learners and the parents, because it has been discovered that most parents, they struggle to communicate with their kids when it comes to issues of sex and sexuality and so on. But by virtue of being a teacher, their impartiality, objectivity can play a very important role. And the fact that learners also spend a lot of time with their teachers, so they can use that opportunity for these teaching moments so that we can preserve the health of the young people. Because if the health of the young people is compromised, our societies are compromised, our communities are compromised, our economies are compromised, and it can go on and on politically, economically, and so on. And that can become a burden to the state at the end of the day. And also, how do we break the cycles of poverty when there is so much teenage pregnancy going around, and the teachers can actually act as a link in between? Thank you.
Thank you so much. Camelia, I'm assuming that we don't have time to take any more questions. Is that correct?
Unfortunately not, but
Okay.
we have saved the chat, so we'll follow up with the speakers and hope to get you some responses. And do note that we do have 2 more webinars coming up regarding health and well-being. So you're more than welcome to join us, and there might be follow responses to your questions. Thank you. Thank you so much, Maki. Now, please let me call on my colleague, Luca, to give us a key takeaway from this session. Luca, the floor is yours.
Thank you very much, Camelia, and thank you, colleagues, for the presentations. I think it has been rich in information. We cannot exhaust all the issues that we have addressed today, so we promise that we will share a consolidated resources on the key messages around the discussion today. But just to acknowledge that we discussed a lot in terms of what pre-service teacher education can contribute to addressing education for health and well-being needs of our young people at the school system. One important issue that was highlighted is the dual role that PRISEF's training institution play in supporting young people who are trained as teachers, as young people themselves who need support to deal and grapple with their own issues around relationships and the health issues that have been highlighted. So that is very important. We are supporting young people for their own benefit, but more critically for their support at the school system when they interact with our learners, building the knowledge and the skills and the right attitudes and values that protect young people from a number of social and health issues that have been discussed more exhaustively. We also learned the different models from the standalone model that Zimbabwe is implementing through the health and life skills education, the core curriculum model that Namibia is implementing, involving multi-sectoral partners, workshops, short events, workshop trainings, and blended approaches to reach young people and provide them with the skills through the experiential learning that they go through. We have just heard from Zambia, the integrated approach where the curriculum-based life and L-SHE program is delivered through core subjects such as biology, social science, religious education, and so forth. All these models have their own advantages and also, of course, their drawbacks. And we will share more information about the challenges of this. I think countries have to respond to their own realities. Preferably, we would say we recommend countries to ensure that education for health and well-being is delivered as a standalone subject, because that is more advantages. But you find that because of the curriculum priorities and competition, it's not always possible. So these other models come in to complement, to ensure that we're able to deliver for young people on education for health and well-being. The other issue that was also stressed is multi-sectoral partnership, being able to draw from education, from health, social sectors, to ensure that everybody bring their expertise to address the issues of young people. And we have seen the Zambia college model, how they are involving civil society organizations, international organizations, and other partners to ensure that they train the lecturers and the students on education for health and well-being issues. We've also seen the development or the proliferation of blended and digital learning platforms. Namibia gave an example of an online course there, or a training that was done online. And we know that UNESCO is also supporting that area through the online comprehensive sexuality education course. And here at IGBA, there are also courses around school violence prevention, gender responsive pedagogy, and mental health and psychosocial support. So all these resources are available to support teachers and PRISEF teacher training institutions to provide platforms to reach as many young people and to develop new skills, since we are in the knowledge era. I will not spend most of your time. I think we are already past 5 o'clock this side. So I want to thank you all for your attention. And if you have questions, please send them. We'll make sure that when we respond, when we send the resources, we are able to respond to all the questions that have been asked, and also to share the additional resources that should help pre-service teacher training institutions to do more, to deliver, because it's more sustainable to actually train teachers to be able to be relevant at the classroom level. That's why investment in pre-service teacher education are very important, especially on this very important subject of education for health and well-being. Thank you.
Thank you so much, Lucas, and thank you for summarizing and giving directions of the resources we have. At IGBA, we also have the knowledge platform, as well as the recordings and PowerPoint will be made available shortly after today. We've also posted a link for the survey about your opinion about our webinar series. Please, your input will help us a lot to improve our sessions. And lastly, I want to thank all the speakers and the participants for staying with us despite there were some technical issues. We are very grateful and we hope this session is helpful to you. Thank you all. And our next session will be on November 20th, and will be the launch of a very important global initiative, the Planning for Healthy and Thriving Learners. So yes, you're more than welcome to join us and also share this webinar series if you find it useful with your network. Thank you so much, and we hope to see you again.
Bye-bye. and God
Thank
bless
you.
Bye. Thank you. Thank you, everyone.
Thank you, colleagues.